Do not hire any caregivers, geriatric nurses, or personal care assistants at your nursing home until you have done these. 1. Review their resumes and certificates properly. Check to see how many hours they had in practicum versus how many hours they were theory, so that you can ascertain for yourself whether the experience at the schools, the chosen schools, was adequate enough. 2, check references before the interview. You're looking for the past nursing homes. You're looking at you're looking at past nursing homes where they worked before. Call, find out what were their attendance record, punctuality, regularity. Find out how they dealt with their residents or their patients. Were they sympathetic? Were they loving? Were they caring? All of those things you try to ascertain before you decide, yes, I'm going to interview this nurse. Okay, so you've decided she meets the criteria, we are going to interview this nurse. When the nurse comes, look at whether she is on time or late. That is a big warning sign. Look at her dress code. I have had nurses come to interview with a thin strap top, jeans, slippers, long nails, painted nails. And those are warning signs because it gives you a little window into how professional the person may be, because at the end of the day, you're coming for an interview and you are not even dressed professionally, right? The other one, look for another warning sign. Miss, I'm sorry, I forgot my documents at home. That's an issue, all right? They need to remember to walk with the stuff. Are they responsible enough to walk with all the documents that are required that you need to see during the interview? Look at their posture. Are they hunched like this? Are they not meeting your eyes? I've had people, nurses, who I had to say, listen, sit up and look at me in my eyes when I'm speaking to you and when you're speaking to me. The eyes are all over the place. It's down, it's up. It sends a signal, right? Speech. What is their language like? Is it broken? Is it I know? Are you feeling, I didn't do that now, miss? You know, you're looking at those things. Not that you wouldn't hire the person still, but more so, if you decide to hire this nurse, you know, you have an idea of the training that needs to go into this nurse to get her to the point that you want her to be able to deal with your residents professionally, right? Number 5, ask nursing questions during your interview. Too many interviews are, why do you like, they are accustomed to that. Why do you like nursing? Why did you choose nursing? Why are you doing nursing? And I have had experience where they tell you all sorts of very nice things. They usually have a grandmother who are a nurse, or a mother, or an uncle, you know, and that made me realize that I wanted to do nursing and so forth. But that does not qualify you. It says, okay, you're empathetic, but it does not qualify you professionally to take care of another human being. So what you would want to do, because they're going to be doing nursing at your institution or in your agency, you want to ensure that they have those information. So some of the things that I asked you in my interviews. 1, what is the normal temperature? And you won't believe that, you know, they look all over the thing. They sometimes they call a number that I don't know where they got it from, right? And then eventually some of them who are honest, that's the next thing you're looking for. Some of them who are honest will say to you, miss, I don't know. I can't remember. I do it in school, you know, miss, but I don't remember. Yeah? What is the normal blood pressure? What is the normal respiration rate? What is the normal SpO2? So at the end of the day, again, it is not going to omit you or stop you from hiring them. It's just that if I decide to hire a nurse like that, I'm seeing other potentials. I know that I would need to now drill down and train her into the professional part of nursing. Yeah, and I always tell, speak to them as a mother would when I'm finished. I say to them, listen, if you do not know the normal vital signs, how would you recognize the abnormal? How would you know that my patient's temperature is up if I don't know what the normal is? Yeah, so basic nursing 101, and most of the times they do not know, right? Another thing that I normally ask, I would say to them, okay, you are bedbatting an 83-year-old gentleman who is bedridden. Give me the steps. Tell me how you will prepare for this bath and how you will conduct this bath. And most of the time, I have not had any nurse really giving me the correct steps. I've had some who have gotten very close, but this gives you a real good idea because a lot of your residents have to be bathed, whether it be bed bath or shower, personal care, personal hygiene has to be attended to. And if you have nurses who do not know how to do this properly, how to conduct a bath while maintaining the dignity of the patient, expose the whole area, no. So if they do not do that, then if I make a decision to hire that nurse, I know that I have to do some training where personal hygiene and bed bath is concerned. Ask those questions. Assess where your nurses who are applying, assess where they are, and decide if you have the resources to convert from where they are to where you want them to be, to give par excellent service and par excellent nursing to your residents. Another question I would ask, okay, what are the things that we would do? What are the steps that we will take to prevent our clients from falling, our residents from falling? And again, most of the time, you're seeing the wheels turning, but they don't know because there isn't much thought into that. Yeah. Another question I normally ask is, how do you manage a resident who just fell? What do you do? What are the steps? Right? So those are the things, some of the things that I ask. Sometimes I ask about movement. I would lie down on the couch in my office and I would say to them, okay, I am bedridden. You want to move me to this wheelchair? Move me. So you would know, again, assess where you are at, who you are hiring, what are the shortfalls, what are the positives, and make a decision. Okay, I can still work with this person, this nurse. I just need to do X, Y, and Z. All right? During the interview, look at their facial expressions. Look at what they are not telling you. Yeah? So that you are able to assess how they feel about nursing, how they really feel. There are other questions you can ask. I was just giving you guys an idea of the nursing questions, some of them that I ask to ascertain the level of education that our nurses who are applying are at, so that we can now plan if we're going to interview them. If we're going to hire them, we can now plan, okay, week 1, this is what I will do with this nurse when she comes in. I will do orientation, I will do X, Y, and Z. Week 2, sometimes I ask about the nurse's notes. How do you write nurse's notes? They look at me blank, like, write nurse's notes? Miss, I never wrote nurse's notes. Sometimes I be writing a notebook, So a nurse's notes is a very legal, very, very legal and very, very important aspect of nursing. Yeah? So I hope that I've been able to assist in some way. We will always have nurses coming through and through. We are not perfect in interviewing, right? We have nurses who come, nurses who go, nurses who we have to let go. But I believe these are some of the things that has helped me to have at least 75 to 80% of my staff still with me and still functioning par excellent.